Hey everyone, let's learn about menstrual cycle. It is female reproductive cycle of 28 days in which female reproductive system undergo various changes. Physiology of menstruation, follicular phase. The phase of endometrium represents the estrogenic part of menstrual cycle. It is initiated and controlled by estrogen. Pulsatile secretion of GnRH, gonadotropin releasing hormone from hypothalamus act on pituitary which secretes FSH and LH. FSH is follicle stimulating hormone and LH is luteinizing hormone. These hormones act on ovary and stimulate growth of primordial follicles which secrete 17 beta estradiol and rupture of follicle, that is ovulation occurs. Release of ova. Functions of estrogen: proliferative changes on endometrium. Endometrium is the layer of uterus. Inhibits further secretions of FSH. Stimulates anterior pituitary to secrete LH. Second one is ovulatory phase. LH causes rupture of follicles, that is ovulation. Peak of estrogen is about 48 hours before ovulation. LH cells 24 to 36 hours before ovulation. A2 level, estradiol level 300 to 500 pc per ml. Luteal phase. It is time between ovulation, menstruation and is fairly constant of 14 days. Corpus luteum is formed from ruptured follicles which secrete progesterone. Functions of progesterone: secondary hypertrophy of endometrium, inhibits LH from anterior pituitary. Amount 15 mg per ml. Menstrual phase. In the absence of pregnancy, both estrogen and progesterone levels decline gradually. This fall leads to menstruation. This falls also initiate positive feedback mechanism and triggers hypothalamus to release GnRH and cycles continue. Amounts: FSH 3 to 15 milli international units per ml, LH 3 to 12 milli international units per ml. There are some terms related to menstruation cycle. Amenorrhea indicates the absence of menstruation. It is symptom, not a disease. Oligomenorrhea, infrequent, irregularly timed episode of bleeding usually occurring at intervals of more than 35 days. Polymenorrhea, frequent but regularly timed episode of bleeding usually occurring at intervals of 21 days or less. Menorrhagia, regularly timed episode of bleeding that are excessive in amount, that is more than 80 ml, or duration of flow more than 5 days. Metrorrhagia, it is regularly timed episode of bleeding superimposed on normal cyclic bleeding. Menometrorrhagia, excessive prolonged bleeding that occurs at irregularly timed and frequent intervals. Hypomenorrhea, regularly timed but scenty episodes of bleeding. Intermenstrual bleeding refers to bleeding that occurs otherwise normal menstrual cycles. Precocious bleeding, occurrence of menstruation before the age of 10 years. Postcoital bleeding, vaginal bleeding after sexual intercourse. Thank you.